Hello and welcome to the channel. I'm Stephen Bunting and I'm a specialist MSK physiotherapist working in the UK. In this video, I'm going to go through a simple but comprehensive exercise program for subacromial shoulder pain, also known as shoulder impingement or rotator cuff related shoulder pain. Now in this video, I'm just going to show you the exercises. If you want to know the details about this condition, including what causes it, how it's diagnosed, some pain relief advice, and then what the options are if it doesn't get better, including when a scan might be needed, an injection or surgery, then go and see my other video all about subacromial pain up here, or I'll put a link in the description below. And then when you know all about this painful condition and where exercises fit in the overall management of it, then come back and watch this video carefully. Okay, so I'm going to show you a simple but thorough program of exercises that you can do at home for subacromial shoulder pain. A home exercise program should be easy to follow and not overly complex, and that's exactly what this will be. In fact, there's only 3 or 4 exercises in each section, and you will generally just be doing the ones in the section suitable for your shoulder pain at your stage. So we start with the easy ones and then take you through the different progressions. Just make sure they are pain-free or as near pain-free as possible while doing them, preferably below about 3 on a pain scale like this. So these first ones are the ones to start with if your shoulder is really painful, because they might be the only ones you can do for the time being until things start to improve. Sit with your back supported and use your good arm to help lift your sore arm initially to about shoulder height and then as high as you can manage without pain. Repeat 10 to 15 times. If you can't do this without pain, then try a pendular swing like this. Just lean forwards to create a space where you can swing your arm gently forwards and backwards and then side to side. You can progress this exercise by pausing for a few seconds in the high positions. And then using a 1 kilogram weight or a 1 litre bottle of water. Another way of doing this movement is by using a set of pulleys like this. In this way, your good arm pulls down and your sore arm gets a free ride upwards. No matter how painful your shoulder is, you should be able to do at least one of these exercises, even if it's through just a small range of movement. It's then just a case of doing them frequently. Once the pain starts to improve, you can then start rotator cuff strengthening exercises. However, this first exercise is very basic and you can probably manage this even when your shoulder is still very painful. Stand with your elbow by your side, bent at 90 degrees. Then gently push the back of your hand into a wall or a door frame without actually moving your arm or body. Hold for about 10 seconds and repeat 5 to 10 times. To progress, try pushing harder and then introduce some movement by using some resistance band like this. Keep both elbows tucked in and then rotate your arms outwards like this. It's best to do both shoulders together, as you can easily judge the strength of one side compared to the other. Keep your elbows tucked into your side throughout the movement. Hold for 5 seconds, repeat 10 times, and try to do 2 or 3 sets of this really important exercise. To progress, you can do the same exercise, but this time slowly raise your arms forward in front of you like this. Another good variation of this exercise is to use the resistance band to do a cross body movement like this. And then an outwards movement like this. And the last one in this section is a forward lean rowing exercise. I'm using a 5 kg dumbbell here, but you can use whatever feels comfortable while still working your shoulder fairly hard but pain-free. So in this section, things start to get harder as we introduced exercises that challenge the rotator cuff dynamically. So by now, your shoulder pain should be improving and you should feel like your shoulder is getting stronger. So I'm going to show you a few different variations of these exercises to suit all abilities. A good basic dynamic exercise is a simple wall press up with both arms like this. To progress, you can move further away from the wall, use a table, or do a full horizontal press up if you can manage. You can also do some hand stepping variations like this, using a small step, a dumbbell, or just a thick book, either in kneeling, with feet crossed, or in a full press up position according to your abilities. A further progression is to do a wall fall like this. Or alternate both hands like this. And you can then progress by doing them off a table like this. Back in the standing position, and you can slide your hand as high as you can up a wall, and then take your hand off the wall and hold for 5 to 10 seconds. For a further progression, you can use a small weight, a litre bottle of water, or a bag of sugar. Another good exercise for stability is the Superman position. So in 4-point kneeling, you get yourself nice and stable, and then take an opposite hand and knee off the floor. Hold for a few seconds and then swap sides. The plank and side plank are also great stabilising exercises for the rotator cuff and can be particularly helpful if you have a sore wrist, which might preclude you from doing some of the previous exercises. Aim for between 10 and 30 seconds in each position and then repeat 2 or 3 times. And the last exercise I'm going to show you is something I learned from one of my patients about 20 years ago. He had a stubborn subacromial pain that wasn't really responding to the usual rehab. It did eventually get better, and he swears that the reason for this was when he started standing up on the bus to work and using the grab handle with his affected arm. And as the bus went along, jolting and jarring his shoulder for that 30-minute journey twice a day, his pain gradually got better over about 6 weeks. This type of exercise must have strengthened his rotator cuff in a way that his shoulder really responded to. And since then, I've increasingly seen this type of exercise being used in rotator cuff rehab programs. So at home, you could use a rope or a strap tied to something sturdy overhead, and then with your feet together, try moving your body around like this. You can progress by balancing on one leg like this, or closing your eyes like this to add that level of unpredictability which can mimic the bouncing bus that helped my patient so much. This is a fairly advanced exercise, so only try it if you can do the others, and indeed this one, without pain. So that's a fairly comprehensive exercise program for all abilities that you can do at home with minimal equipment. Just start with the easy ones once a day, and as your pain improves, you can then move through the different progressions and do more repetitions. It's going to take about 3 months and maybe more, so be patient and don't be tempted to push on to the next section until you're ready. If things do flare up, then take a few rest days before starting again, but this time at a lower level and progress more slowly. The rotator cuff tendons are slow to adapt and heal, especially so as we get older, so be patient with them. Okay, well that's about it. Don't forget to check out the other video all about the details of subacromial pain. Well, good luck in your rehab, take care, and bye for now.